Hello everyone, my name is Dr. Sagar Bhargav. I'm a cataract, glaucoma and a refractive surgeon. Glaucoma, the word itself scares anybody. The moment a diagnosis of glaucoma is made, patients are usually perplexed. What next is the obvious question in the mind. And if you don't have enough information about it, you will notice that you're being called by your doctor again and again for eye pressure testing. Then multiple times other investigations are being done, and you are applying the drops, but you don't feel any change in your vision. So what exactly is happening? You have no clue at all. So the idea of putting this video was to help patients who had just been diagnosed to have glaucoma to understand what exactly should be the next steps and how those steps are useful in the long-term control of glaucoma. Glaucoma, for people who don't know, is a condition where the optic nerve, which is the nerve which carries visual signals from the eye to the brain, gets weaker with time if the treatment is not given. And this weakness translates into reduction in the peripheral field of vision initially, and gradually this peripheral field of vision becomes smaller and smaller until the central vision is lost. So the end stage is total blindness unless a proper management is instituted. Now, the first thing that you need to make sure is ask your doctor whether am I a glaucoma suspect or am I a confirmed case of glaucoma. A lot of times, the patient has been put on anti-glaucoma medication with some degree of suspicion with regards to glaucoma, but the doctor is not really sure about it. This differentiation is important because in a suspect patient, over a period of time, when the doctor is convinced, there's a possibility that the medications will be off. But if it's a confirmed case, the medications will have to go in for lifetime. So first thing is clear in your head whether you're an established case of glaucoma or you are just a suspicious case. The next step is to find out what is the type of glaucoma that you have. So there are essentially two broad categorizations or two broad groups of glaucoma. One is primary open-angle glaucoma and second is primary angle closure glaucoma. This categorization is important because the initial management will vary. Also, primary angle closure glaucoma, the risk of blindness is more than open angle glaucoma as it progresses very fast. In India, we tend to see both the glaucomas in equal incidence. In Western population, primary open angle glaucoma is more common. So once the diagnosis of type of glaucoma is made, the follow-up and the treatment protocol will vary. Next comes the investigations. So investigations have three roles to play. One is to establish the diagnosis. Second is to give a baseline data which help us to follow in the long run. Third is to establish the severity of glaucoma, which will help us to decide the management of that particular case. So there are three main tools of investigations. One is visual field analyzer. As the name suggests, it basically chalks out the visual fields that the patient is able to see and detects defects which can happen because of glaucoma and document them, and useful for follow-up because if the defects are increasing, that means glaucoma is progressing. Second is retinal nerve fiber layer thickness assessment, that's called as OCT. And the third is taking a photograph of your optic nerve. Remember, I told you it's an optic nerve condition, so we take a photograph of the optic nerve and use it for long-term follow-up. With regard to visual fields, it's a test which requires a total cooperation or involvement of the patient. In other words, it's a subjective test. So this test essentially finds out whether there is any defect because of glaucoma which is set in. So defects usually start in the periphery of the visual fields, and they are noted. Usually, one field test is not enough to be certain about the level of defect. So visual fields are repeated at frequent intervals in first 2 years. Almost 4 to 5 times these tests are done to establish a good baseline. Also, in the first 2 years, it will tell us whether the treatment that we have started has it stabilized the glaucoma or not. OCT or nerve fiber layer thickness assessment is more of an objective test where patient has no role. The machine essentially measures the nerve fiber layer thickness and compares it with an age-matched normative database and tells us which areas of the optic nerve have got damaged. Next is to classify the patient in terms of severity of glaucoma, which is usually done from perimetry. To understand perimetry, I'm just showing you a normal visual field, and you can see from this chart that there is only one black spot. Now this is a normal black spot which is present in all the patients, but rest of the areas are all white. Now compare this with the next photograph, and you can see some black spots have started to come in the inferior part of the picture, which is basically nothing but an early defect. And as the glaucoma progresses, it it becomes a moderate defect, as seen here. And in patients with very advanced disease or advanced defect, you can see that the black area has almost covered the whole photo, and you have a very small white area left. So this visual field test helps us to find out at what level of defect the patient is in. The aggressiveness of the treatment would depend on the severity. More severe the condition, it has to be a very aggressive treatment. Next comes the treatment. So treatment, there are mainly three mainstays in treatment. One is medicine, second is laser, and third is glaucoma surgery. Now laser procedure is usually done in patients who are diagnosed with primary angle closure glaucoma, and that is the first step of management. And once the laser is given, then patient is put on medications in the form of eye drops. There are many eye drops which are available, so the doctor essentially chooses the drop which will suit your eyes and will give the desired effect. Rarely, if the patient's eye pressure is not controlled with medications after giving sufficient time, might also have to undergo a glaucoma surgery which is called as trabeculectomy. This surgery, the role is to basically bring down the eye pressures to the normal levels so that patient's optic nerve is saved. Along with this treatment, a certain lifestyle modification also needs to be done. Of that, foremost is avoid drinking large quantities of water in one go. So not beyond 1 liter one should really drink within one sitting. So the total amount of water is not restricted. It can be anything which you feel comfortable with, but it has to be divided throughout the days. Preferably, if you have to take water, 2 glasses of water should what we take at one time. Next is patients who have very advanced glaucoma. They will have difficulties while moving around. So they are more prone to falls and injuries because they are not able to judge depth. So they will have difficulties in navigating themselves through the markets, through the busy roads, and even while walking down the staircase. So they have to be very, very careful. In fact, it's always preferable for them to take along one attendant whenever they are going out in busy streets. Tobacco in any form should be avoided because this can have a direct effect on the optic nerve. Certain yoga postures have to be avoided, for example, Shirshasana, Sarvangasana, and certain more postures as shown here, because these are the postures which can actually cause increase in eye pressures. So this one has to keep in mind. Then one has to take care of their general health because eye is part of the body. So you have to take care of your general health. Regular daily exercises like brisk walking for 30 minutes extremely useful because it increases overall blood supply to the organs. Then keeping a good control of blood pressure and diabetes, because both these conditions can cause reduction in the blood pressures, a reduction in the blood flow and blood supply to the optic nerve. One more thing is, if the patient is taking antihypertensives at night time, it should be requested to the physician who's treating the patient to avoid that, because there is a high chance that patient can develop episode of hypertension or low blood pressure at night time. And patients who have problems of snoring should definitely consult a pulmonologist to rule out a condition called as obstructive sleep apnea, which is known to cause progression of glaucoma in spite of all the treatment. So the next thing comes is how to follow up the patients. So follow up will depend on the severity of the glaucoma and how high is the intraocular pressure. Usually the first follow-up is done around 4 to 6 weeks. If the IOP or eye pressure gets well controlled, then the patient is kept under follow-up every 3 to 4 months. In every follow-up, what is noted is stability of glaucoma and tolerability of the medications, and also ensuring that the patient is compliant enough and is not missing medications. So this is what has to be followed very strictly. Intermittently, tests have to be done. As I told, perimetry is a test which will be needed to be done at least 4 or 5 times in 2 years, and then once the glaucoma is totally stable, then probably once in a year. OCT is another test which has to be done once in a year. Follow-up will also tell us that if the glaucoma is progressing in spite of best efforts, is the time for surgical intervention. This is how, in brief, what every patient who has been recently diagnosed as glaucoma should know. To summarize this, so whether you have a confirmed glaucoma, what is the type of glaucoma, what are the investigations are needed, what is the stage of your glaucoma, what are the treatment options, what lifestyle modification you will need, what are the general health issues that you need to take care of, and finally, what is the follow-up schedule for glaucoma. This understanding is like half the battle won. This will help you understand glaucoma better and will make you adhere to the treatment guidelines which your treating doctor has given you more strictly, and eventually will lead to a better glaucoma control in the long term and help preventing blindness. Thank you for your kind attention.